Hello everyone. So in this lesson we'll be discussing the vomit. First of all, it is important to differentiate vomiting from regurgitation as there are two different conditions and owners are often unaware of the difference. That being said, the vet should ask a complete set of questions to the owner and perform a good physical examination to differentiate them. Ask the owner to describe the episode as retching, so abdominal contractions, or the presence of bile is common in vomiting. In rare cases, bile may be present in regurgitation due to reflux of bile from the stomach into the esophagus prior to the regurgitation. Vomiting is usually associated with signs of nausea, such as salivation, whilst with regurgitation, owners report that the animal simply lowers the head and there's content expelled. Videos of the episodes are very helpful if the owner has them to differentiate these two conditions, so ask for them. The pH of the exposed material has been considered a possible differential test as vomited material is expected to have low pH and regurgitated material neutral or high pH. In cats, regurgitation is uncommon, so we can assume more often to be vomiting and non-regurgitation. Today we are going to focus on vomiting, one of the most common reasons why dogs and cats present to the vet. Vomiting, as opposed to regurgitation, is a central mediated reflex with coordinated closure of the nasopharynx and glottis to protect the airway, reducing the risk of aspiration pneumonia. Vomiting is initiated here in the emetic center located in the medulla oblongata of the brainstem. When activated, most of pathways descend from the center and trigger vomiting. The vomiting center can be activated directly by irritants or indirectly following the input from four principal areas, so the gastrointestinal tract, the cerebral cortex and thalamus, and the vestibular region, and the chemoreceptor trigger zone. The chemoreceptor trigger zone is closest in proximity to the emetic center in the floor of the fourth ventricle, and unlike other brain centers, it is not protected by the blood-brain barrier, being very exposed to stimulants. Stimulants can be endogenous as uremic and or hepatoencephalic toxins, or exogenous like drugs and toxins. Dopaminergic, histaminergic, adrenergic, serotonergic, cholinergic, and other receptors are present in the chemoreceptor trigger zone, and are activated by these stimulants that then activates the emetic center. Once this center is activated, efferent pathways travel within the several cranial nerves to the upper gastrointestinal tract, within vagal and sympathetic nerves to the lower tract, and within spinal nerves to the diaphragm and abdominal muscles that culminates in vomiting. Causes that can trigger all these pathway of vomiting are metabolic diseases as renal disease, hepatobiliary disease, electrolyte and acid-base derangements, and endotoxemia, endocrine diseases as hypoadrenocorticism and hyperthyroidism, toxins and drugs as heavy metals, ethylene and NSAIDs, antibiotics and chemotherapy, diet as indiscretion, allergy or intolerance, abdominal diseases as pancreatitis, peritonitis or neoplasia, gastric diseases as gastritis, parasites, helicobacter, foreign bodies, obstruction, gastric dilation, volvulus, motility disorders and neoplasia, small intestinal diseases, inflammatory bowel disease, neoplasia, obstruction, parasites and infections, and large intestinal diseases as constipation and colitis. Severe or prolonged vomiting can have significant consequences, including dehydration, acid-base and electrolyte disturbances, aspiration pneumonia, and esophagitis. The initial treatment should be aimed to the primary disease that I just talked about, which often resolves the vomiting. Acute vomiting usually resolves with hydration and fasting for 12 to 24 hours, but in acute cases with severe vomiting, it may be beneficial to use an antiemetic as meropetent and metoclopramide for improving comfort and nutrition and preventing excessive fluid losses. Chronic cases of vomiting should be studied to identify the underlying disease, and in these cases be careful with antiemetics as it can mask an underlying disease. Hope you guys liked it and hope you understood the physiology of vomiting. If you have any questions, please leave a comment below, and if you like this video, like and subscribe. I'll see you in the next video.